I've been asked to make a few comments about adult parents helping their senior parents with their healthcare needs. As I approach this with my patients, I always encourage them to start with communication. Sit down and talk to your senior parent about their medical situation. Find out what their diagnoses are. Get to know who their doctors are, who their medical doctor, who their dentist, who their eye doctor is. Learn what kind of medications they're on and which doctor prescribes them and what they are actually for. Make a list, write things down. Take a history, a medical history with your parent. Find out what kind of surgeries they've had, what kind of illnesses their parents may have had. As your parent gets older, their memory may fade. They may not be able to recall these things. So write them down so it helps you and your siblings to help address your parents' health needs. Also, find out what immunizations they have had. Do they get a regular flu shot? If they don't, find out why not. Find out what their allergies are. Make a health document that you can use when you go to doctor appointments. Also think about when you're talking to your parent, do they need help when they go to their appointments? Do they understand their medical care? Maybe someone needs to go with them and make notes so that they can be referred to and help them along their medical journey. That's kind of an overview as you approach a senior parent. And I was going to focus on 4 areas a little bit more specifically. One area is in-home safety. Sit down with your parent and go through their house and look for things that could be a danger. When we are parents of young toddlers, we go through the house and we childproof it. We plug outlets and we lock up chemicals. We avoid things that can be reached by a young toddler. Well, we have the same purpose, but with just a different goal when it comes to seniors. We walk through the home looking for, probably the number one thing is what could cause a fall. Throw rugs, shoes, anything that's laying around that somebody could trip or fall over. We also look at lighting. Is the home well lit? So that you can see things. Is the light working over the stairs so that somebody doesn't try to go down the stairs in the dark? We look at the bathroom. We look at the shower, the tub. Is the tub accessible? Can you get in and out of the tub? Or do we need to add things like grab bars or things to help steady people? We also look at how are things functioning in the house. Is the furnace working? Are there adequate smoke detectors? Do we have carbon monoxide monitors? We live in Minnesota. There's always issues of climate, snow and ice. Are they able to clear their sidewalk so they can get in and out of the house safely? Last winter we had a lot of snow. A lot of sewer vents were having issues. Does your senior parent need help accessing or at least looking at the roof to make sure everything is safe? Another area that we think about as our parents get older is their nutrition. Are they having good access to good, healthy food? And access can be for a number of reasons. We can look at, do they have access to get to the grocery store to buy food? When we talk about buying food, do they have adequate resources to purchase food? When they get food, do they have the ability to prepare it? Can they safely navigate the kitchen? We also think about when the food is prepared, as we get older, are our teeth in good repair? Do the dentures fit? Can they chew or manage that kind of food? Another area that I think is of very big importance and can cause a lot of issues is medications. I think a lot of people as they get older get to be on a number of medicines. Sometimes they don't know exactly why they are on these medicines. I think it's important when you sit down to talk to your senior parent to inquire, what medicines are they on? Make an adequate list that can be used for future doctor appointments. Find out who is prescribing these medications. Find out, are they having any troubles taking them or remembering to take them? Do they need help setting up a pill minder? Organizing the timing of certain medicines, because the medicines sometimes can be complicated and the regimens can be complicated. We do our best to try and keep them simple, but sometimes they get a little overwhelming and we need help. The other thing that's a little new to our issues with medications now is affordability. Some medications unfortunately cost a lot of money, and depending on insurance coverage or Medicare or Part D plans, some of these costs put some medications out of reach. I think it's very good to have a talk with your parent to find out, can they afford their pills or their medicines such as insulin? And if not, look at ways that you can help them, either with a pharmaceutical company patient assistance program or getting some help with social services. The last area that I wanted to bring up today was regarding what sometimes is a very difficult issue, and that's driving. When should our senior parent stop driving? It can be sometimes very easy, but oftentimes is a very difficult decision. I'll go back to what I said earlier. Communication, I think, is the key. Starting a conversation with your parent early, long before you have any concerns about their driving. Start talking about well, what if, we think, mom or dad, that you're not, able to drive anymore. Are you going to be receptive to our talking to you about it? There are many things that come into play when it comes to driving. There's vision, there's hearing, there's physical or motor skills, and there's also mentation or decision making. All of those things have to be working in order to have safe driving. So it's important to be asking your mom or dad about these medical conditions. I think one good rule of thumb that I encourage patients and their children is to go for a ride with mom and dad. Get in the car with them and go through different types of traffic situations. If all of a sudden you're feeling uncomfortable with their driving, that should be a significant red flag that this is an issue that should be pursued. If there is any question about whether or not a person should be driving, there are ways to do testing through occupational therapy. They can do a driving assessment, which sometimes involves a simulator, sometimes it involves behind the wheel assessment of the driving skills. This is oftentimes done up in Fargo. In general, I think the big thing that can help a lot of seniors is if their adult children take an interest in their health care. Go with them to doctor's appointments, write down their medical history, note their medications, and just kind of keep track of them. I think it'll go a long way to improving their health.